everyone. It has been almost 2 weeks since my last video, and I kept thinking over the last, week anyway, that I should really, make a video to update about what's going on and everything. So I'm finally getting around to it now. It's 6:30 at night, and Eric will likely be home relatively soon. He may call while I'm making this, but I just didn't find another time to do it, so I'm going to try to squeeze it in now. So overall, things are going relatively well now. I've been struggling a bit. I don't remember when I made my last, I made my last video 2 weeks ago, so at that point, the morning sickness and stuff had hit, and it has not been fun. It's, for the most part, like, just constant queasiness, nausea, but it, like, a week and a half ago, I started throwing up some days, so that wasn't really a fun addition. At this point, I think it's been, gosh, what's today? Today's Wednesday. Oh, it's actually only been like 2 days since I threw up last. It feels like it's been longer, but basically, I feel like I've made a turn in the right direction yesterday and today. Day before yesterday, I started taking B6, which is supposed to help with morning sickness, and I'm gonna attribute the feeling better to the B6. I'm actually taking it in combination. Excuse me. I'm actually taking it in combination with Unisom, which, if you're not familiar with it, is basically it's an antihistamine that's marketed as a sleep aid. And so yeah, so that combination is supposed to be very safe and very effective with helping with morning sickness. And so far, it's been really good for me, knock on wood. It's only been 3 days of taking it, but so far, like yesterday and today, have been markedly better. So that's good. One of the things that I am really struggling with is I'm supposed to be on Mepron, and it's not the easiest medication to tolerate normally, and then throwing in morning sickness, even when it's not horrible, it just makes it so much worse to take it. So I finally, I have basically not been taking it every day, and at this point I think I haven't taken it since Saturday. So I finally got in touch with my doctor and tried to find out, what do I have another option, or is this really necessary this early? Can I wait and see if I do better in the second trimester and everything? And she called me back and left a message. I missed her call somehow, and said that I can just stop taking it for now, and once I get into the second trimester, try to take it again and see if it's more tolerable. If it's not, then I can stop it and go on something else. So I wouldn't be having that protection from the Babesia if I stopped it. Although the alternative that she mentioned was to go on Zithromax, which, in combination with Mepron treats Babesia. So I don't know if that provides a little bit of protection, but I'm not extremely concerned about transmitting Babesia to Poppy. We're calling the baby Poppy. Partly because mine has not been, my case of Babesia has not been an issue lately. It's probably been at least a year since I was really on any kind of treatment for it. So I'm not super concerned about it, but we'll see. I'm gonna stop it now for the next 3 weeks, and then try to restart it and see if I can manage at that point. Um, so that's that. I also, like, as far as pregnancy stuff goes, which is kind of a focal point of my life lately, I have finally managed to get kind of a final word from the maternal fetal specialist, and um, he had my clotting factors tested, and those came back normal, so that's a relief. So his recommendation or his assessment was that it's not necessary for me to be on blood thinners, that it would be an option if I and my doctor wanted to just be really safe, really on the safe side. His main concern would be that I would develop a clot around my port and lose the port. If that were to happen, like, that's not, if his concern was that I was going to develop, you know, a blood clot and have a stroke, or, you know, something like that, I would take that much more seriously. But that's not really the concern. So my doctor and I have discussed it and decided that, you know, we're just not gonna go there. We're not gonna do blood thinners. So that's a relief. And now I have an appointment at the second birth center that I toured tomorrow to kind of go over my history and the records from the specialist, and make kind of a final determination as to whether I can be a patient there. But it's looking good. It's looking like I will be able to, so that's really positive, and I'm really glad about that. So, yeah. Otherwise, I'm just kind of laying low most of the time, resting, trying to eat as much as I can. I have my weight fluctuates normally, but I believe I've lost maybe 3 pounds from my pre-pregnancy weight, which is not fantastic, but it's not really a concern. So, you know, just trying to eat a little better now that the nausea is calming down a bit. And yeah, that's more or less it. Eric and I, excuse me, Eric and I have planned a like little mini baby moon to go. We're just going away, like not like an hour and a half away, for a Columbus Day weekend, which should be fun. I'm looking forward to that. Our first vacation was to the same place, our first vacation together. So it'll be nice to go there and just kind of have a relaxing long weekend. So yeah, so that's pretty much it. Not a whole lot, you know, really that Lyme related. Just kind of plugging along and looking forward to. So I'm now nine weeks pregnant. So looking forward to like 3 or 4 weeks from now, when hopefully things will start getting a little bit easier, and I'll kind of get back to a little bit more of what my norm is. Not so much lying on the couch, which will be nice. So yeah, so that's it for now. I will try to do another update soon, but I mean, I don't know when it'll happen. So that's it. And yeah, I hope you're all doing well. I know a lot of people have been really quiet, so you know, I hope to hear from all of you soon, and hope you're doing okay, and I'm thinking of you. So I'll talk to you soon.